let's see if the Chief Executive has anything to say, and then if not, then we could go straight to questions. Well, I have a tight schedule this morning, so please go to questions. On the left, on the front row there. I'm from Apple Daily, Mrs. Lam. Good morning. About, Mr. Leung Chi-chiu, an expert on respiratory diseases, has criticized the criteria you've adopted in setting these designated control areas. He thinks the criteria are not clear and you're not able to, cut the transmission chain. In Taikushing, Lokyong, and so in Chinwan, you have not adopted this control areas measure, but then in some buildings there's been no infection cases in past few weeks, and then you decided to blockade this building. So some question whether the biggest party to benefit from all these measures are the testing companies. Now, President Xi Jinping said that he's worried about the fourth wave of the outbreak. So does it mean that the government he's not happy with the government's effort in controlling the epidemic? And then for Sinopharm's inactivated virus vaccine. Now, in Macau, it said that they will get the vaccine this week and they could start vaccination before or after Chinese New Year. You've indicated you would like to procure this vaccine, but then experts in Hong Kong said that they must see the clinical report first before these vaccines could be sent to Hong Kong. So how are you going to deal with this conflict? Would you go, bypass the experts panel in making the arrangement? Thank you. First, about these notices or declarations of the various the designated zones. Now we have already announced the criteria for doing that. I will repeat them today. There are 3 criteria to go by. First, public health consideration. And confirmed cases is only one of the factors. Now, in epidemiological considerations or with any tracking of cases, if there are factors that could cause concern to the healthcare experts, then we will consider that. So the number of confirmed cases is not the only deciding factor. The second factor is the building condition, or perhaps it has to do with the environmental hygiene or the condition of the building. For example, the sewage system, or for 3 new buildings, it's also about the management of these buildings, because with 3 new buildings, perhaps the transmission risks are higher. The third factor is manpower. In other words, even if we wish to do more, we have to consider our capacity at any one time. So these are the 3 factors in helping us make our decision. Yesterday at the press briefing and today in media report, it seems that people are not sure who are there to make the decision. Well, I can make that clear. In CAP 599, on making such notices or the declarations, is the Secretary for Food and Health that has the power to do so. She will have regard to the 3 factors, and based on information she receives every day, she will decide on which places she might impose this declaration. So please bear that in mind. Now, and in conducting such operations, there are 3 requirements. First, these operations must be kept confidential. You can see that in recent operations we've been able to do that, although the people may have guessed, but at the end most residents were not aware of such operation beforehand, so we're able to achieve confidentiality. The second requirement is such operation must be targeted. Now, Jordan is a large area. You may say Hong Kong is a small city, but for Jordan, there are over 150 buildings. It's still a large area. And with our internal assessment, we believe there are about 1,000 residents involved for each case. And otherwise we couldn't cope. And the third requirement is that we try to keep the arrangement, the operation short, hopefully within 12 hours. That is from 7 p.m. Till 7 a.m. So we want to complete the tests in time and get results in time, so residents could then leave with a wristband on them. on the effectiveness of such operations. Now, I've tried to play the role of experts, and I've said this a few times. Now, from the point of view of public health, it's not that treating the disease means success, but rather it's about preventing the disease. So it's mostly preventive effort. It's hoped that we could take actions before that's transmission. So you can't really measure the effectiveness of such operations by the number of cases identified. If we couldn't identify cases, well, it could be due to is not the key point, but relatively we could then confirm the factors such as environmental hygiene or the building condition are safe. Now, we have conducted a there's mention of the universal compulsory testing scheme, but we need to have a lockdown for a certain period. Otherwise, with the movement of people, there could still be risk. But now the facts tell us that we are now taking this targeted testing approach because it's not possible to carry out testing on an extensive area. And you can see that these operations have been effective. Of course, every time in deciding which area should be a designated control area for testing, it's based on scientific assessment. And sometimes it's not, you cannot be 100% sure in terms of science that we should do this for a particular area. I don't think this is waste of resources doing this. Now, at an earlier stage, many people have asked for universal testing, but we believe that program has limited effect, and then we need large amount of manpower and also other public resources. Now, you asked whether these operations would benefit the testing companies. Really, you can't say that. Now, for all the private testing laboratories that partner with us in these operations, they are just taking part in the operations because they want to serve the public. Now, the unit test cost of fee of $200 is not enough to cover costs. It's easy for you to do the calculation. Now, $240, say, times the 300 mandatory tests, you can count how much is involved. But then you go and see, you see they set up so many mobile specimen collection centers for 12 hours or more. They have so many people there taking the specimens, and then they have to go back to the laboratories to do the tests, and in a short period of time. So please be fair to the contractors, that is the private laboratories. I think I'm duty bound to say that, you know, if you've been following all testing operations, really you have to be fair to the private laboratories. Another point is how I report my work to the central government. That is a matter for the central government to decide. You know, because of the epidemic, you know, earlier in Beijing there have been some sporadic infection cases. So therefore, the central government decided that for me to report my work in 2020, it should be done via a video conference. And as the usual rule of the central government that such reporting of work would not be made public before it's carried out. So, but after the occasion, the Xinhua news agency and our government have issued press release. Now, the presidency is, of course, very much concerned about the epidemic in Hong Kong. We're still in the fourth wave of the outbreak, and the presidency has expressed concern and worries that's totally reasonable. If the president says that, well, it seems that the situation is serious in Hong Kong, but I'm not worried at all, it wouldn't make sense. So I believe the president is very much concerned, and he wants to support us. He, of course, wants us to double our effort, and then the central government hopes that we are, they will give us support, and hopefully then we could control the fourth wave of the outbreak. Your third question on vaccines, that we have used advanced purchase agreements to procure the Sinovac vaccine. That's an inactivated virus vaccine. And there's another vaccine that we've explored, but we were not able to procure it. That's the Sinopharm vaccine. So what we would like to do is to obtain the data for this inactivated virus vaccines, and then the experts could recommend these vaccines to the Secretary for Food and Health for emergency use in Hong Kong. So I've asked for support from the central government on such issues. I didn't mention any particular vaccine. Rather, for vaccines developed and produced on the mainland, it's hoped that these could be made available for use in Hong Kong for emergency use. The central government is fully aware of a legislative framework for emergency use of vaccines. In other words, there have to be sufficient data for evaluation by experts. And then the Secretary for Food and Health would authorize the emergency use. So there is no conflict there. Thank you.
Next question, please. The gentleman on the back row, please.
0 cases have been found in the 6 recent quick lockdowns the government imposed in the past few days. So how would you evaluate the effectiveness of such measures, given that there has been no cases found? And also, how would you respond to expert suggestions that an ambush-style lockdown may not be really able to contain the spread of the virus, because there are still many people who may be